Hello, I'm Malcolm Wright, Chief Executive of NHS Education for Scotland, and I warmly welcome you to my first podcast of 2012. For those of you not familiar with NHS Education for Scotland, or NES for short, we're the National Health Board responsible for leading NHS Scotland workforce development, education and training. A key policy driver for our work is the Scottish Government's quality strategy and the ambitions outlined in that strategy to deliver safe, effective and person-centred care for the people of Scotland. NES has an essential leadership role in the delivery of that healthcare quality strategy and its core ambitions. In 2010 we established a group under the chairmanship of Professor Brian Durwood to coordinate activities across our organisation to maximise the organisational response to the quality strategy. This group is ensuring a systematic collaborative approach to developing and disseminating our contributions to the three quality ambitions. These improvements are being delivered by creating synergies from across the wide range of our existing educational and training activities. Examples include tailored safety interventions for primary care and providing our Quality Hub partners with substantial support in the area of information and communication technology, or ICT for short, for the Quality Improvement Hub, and understanding the role of human factors both in quality improvement and patient safety, and investing in educational interventions that embed human factors awareness into education and training. Of course, our workforce development, education and training remit is no longer solely focused on the staff of NHS Scotland. The Scottish Government is committed to the integration of health and social care sectors. The core assumption that underpins this is that a workforce that learns together works together. They will share common goals and values, and they will produce better outcomes for individuals and communities. We're already working very closely with the Scottish Social Services Council to deliver on this important agenda for Scotland. An excellent example is our joint work on supporting Scotland's National Dementia Strategy, which was published in June of 2010. There are approximately 82,000 people with dementia in Scotland, and this number is expected to double over the next 25 years. The government's strategy outlined a number of key challenges and change actions that require significant change in the way that health and social services in Scotland respond to dementia. In June 2011, NES and the Scottish Social Services Council launched Promoting Excellence, an education framework for health and social care staff working with people with dementia in Scotland and their families and carers. Over the next 3 years we will be implementing that framework with specific education and training products and programmes. For example, February saw the launch of a DVD to support all health and social services workers to achieve the knowledge and skills set out in the Dementia Informed level of practice, which is the baseline level of knowledge and skills required in the Promoting Excellence framework. March saw the graduation of the first cohort of staff training as dementia champions. We commissioned Alzheimer's Scotland and the University of the West of Scotland to develop, deliver and then evaluate this programme. Participants in the first cohort comprised 88 nurses, 19 allied health professionals and 2 medical staff. Their role will be to lead improvements in dementia care, to sustain change in their area and cascade information and education about dementia to other staff. NES itself is not standing still as an organisation. We are undergoing a major change management programme designed to make us fitter and energised for the challenges that face us in 2012 and beyond. More of that in future podcasts. I want to finish by paying tribute to 2 long-serving members of staff who retired during 2011. Dr. Jim Rennie, our postgraduate dental dean, and Helen McKinnon, Director of Nursing, Midwifery and Allied Health Professionals. Jim and Helen not only led their professional directorates with enormous commitment and professionalism, but they were also invaluable executive members of the NES board. On behalf of colleagues, I wish them well. We now have the talents of Dr. David Felix as the Dental Dean and Dr. Colette Ferguson to take over from Helen McKinnon, and I look forward to working with them as we continue our work to support the health and social care workforce in Scotland. Finally, at the end of March, Dr. Mike Watson retired from the role of Director of Medicine. Mike not only made a major contribution to NES, but also masterminded the introduction of modernising medical careers in Scotland. This major change in the educational and training of junior doctors is a critical step on the path to a service delivered by trained doctors rather than by doctors in training. My successor is Dr. Stuart Irving, who held the role of Deputy Medical Director at NES. Stuart's extensive clinical research and medical educational expertise will be of critical importance as we face the challenges and opportunities of service development over the coming years. Thank you for taking the time to watch this podcast. I hope that you will find our website easy to use and full of relevant information.